Ladies, we need to talk about TempDrop. TempDrop gives you everything you need to effortlessly track your fertility. Wear the TempDrop sensor while you sleep for accurate temperature readings without the stress of early morning wake-ups. TempDrop's accompanying app enables you to chart an array of symptoms alongside your temperature, including cervical mucus and OPKs. Combine these fertility signs all in one place to identify your fertile window and confirm ovulation. Whether you're trying to conceive, avoiding pregnancy, or want to chart for health reasons, TempDrop makes fertility awareness accessible to all women, even if you don't have regular cycles or sleeping patterns. Head over to fertilityfriday.com/TempDrop and use coupon code FertilityFriday at checkout for 10% off your order. That's fertilityfriday.com/TempDrop. This is the Fertility Friday podcast, episode number 446. Welcome to the Fertility Friday podcast, your source for information about the fertility awareness method and all things fertility. I'm your host, Lisa Hendrickson-Jack. I'm the author of The Fifth Vital Sign and the Fertility Awareness Mastery Charting Workbook. I'm a certified fertility awareness educator and holistic reproductive health practitioner with over 20 years of experience teaching women to connect to their fifth vital sign through menstrual cycle charting, balancing hormone health, and optimizing the menstrual cycle without hormones. I have been consistently outspoken about hormonal birth control over the past 2 decades and its impact on fertility and overall health because you have the right to know how your body works and how artificial hormones disrupt that natural process. I teach women's health professionals how to utilize the menstrual cycle as a vital sign in their practices, and I host live coaching programs to help you achieve optimal fertility and health because it's important to have healthy menstrual cycles regardless of whether or not you want to have babies. I'm also a wife and mother of 2 beautiful boys and a brand new baby girl. This podcast is designed to empower you to take full control of your cycles, your fertility, and your overall health. And I'm so excited that you're here with me today. Today's episode is a heavy one. Today, I invited one of my FAMM practitioners, Rebekah Mustaleski, on the show to talk about pregnancy loss at the various stages of pregnancy, from early loss to later term loss. And this episode came about after we had a class together in the FAMM program, and for one reason or another, this topic came up, and Rebekah started to share her experiences as a midwife supporting women through loss at various stages. And so in today's episode, this is important information. That's really why we decided to release this episode, because in this episode, you'll hear details that we don't often get to hear and certain specific characteristics of different stages of loss and what to do in certain situations. Things that people don't really talk about because it's hard to talk about, but details, frankly, that we should all be aware of. Rates of miscarriage and pregnancy loss are far higher than we anticipate. It's much more common than we talk about. And my hope for today's episode is to raise awareness and just to have that difficult conversation. So just as a warning for you, this episode is certainly triggering, and take any time you need throughout the episode or after the episode to take care of yourself, because like I said, it's a heavy one, and we really get into it in today's call. So before I jump in, I'll share a little bit about Rebekah. Rebekah Mustaleski is a certified professional midwife with roots and wings midwifery in Knoxville, Tennessee, where Rebekah promotes evidence-based maternity care for families seeking an out-of-hospital delivery. She is working to improve maternal outcomes during the childbearing years and to promote a sustainable business model for midwifery practices across the country. Rebekah is owner and woman in charge of Roots and Wings Midwifery and the Maternal Compression Director for Motif Medical. Outside of work, she loves to read, drink coffee, and have all sorts of adventures with her 4 kids, 3 cats, 2 dogs, and 10 chickens. So without further ado, let's go ahead and jump into today's episode with Rebekah. And I'm excited to be here today with Rebekah Mustaleski. And she is a member of the class of 2022 FAMM program. And in today's episode, I had actually chatted with her a little bit about talking about her specialization, but talking about one of kind of a more difficult topic, which is pregnancy loss. And so this came about because we were having one of our regular classes and we had kind of got into it. And Rebekah started just sharing a lot of important information that we should all really be aware of if we ever experience a loss, things that we're not necessarily told. And it was such a detailed, powerful conversation that I was like, I think we should do this on the podcast as well, because there's so many women that need to hear this information. So thank you so much for being here with us today, Rebekah.
Yeah, thanks for having me.
Well, I'm so glad that we have this opportunity. Before we get into the topic of the day, though, I thought I would ask the same question I'm asking everyone in the series, which is if you wanted to share a little bit about what brought you to fertility awareness. So you can share as much or as little as you want, but I'll throw it out there. How old were you when you had your first period? How did that all go? And maybe just share with us a little bit about your experiences leading up to wanting to incorporate fertility awareness into your midwifery practice.
Sure. So my menstrual history is actually pretty boring, or I feel like it is. I got my first period when I was 13. It's always been very regular. I haven't had any significant period pain or issues before I had babies or after I've had babies. I am 40 something now. I can never remember how old I am. I'm 40 something now. And so I expect that they'll start changing soon, but they haven't yet. They're still coming regularly and it's all very predictable. So my own personal history isn't what brought me to your FAMM class. I came here because I am a midwife and I work with all sorts of people that have all sorts of other things going on with their cycles. And I do work with a population that is not a big fan of hormonal birth control. And so often after they have their babies, we have a conversation about what their plan is for family planning. And I've found that there's a lot of people out there that want to know more about tracking their cycles and being able to either prevent or achieve a pregnancy if that's what they want to do right away after they have a baby. But I didn't learn this information in midwifery school to be able to share with them. So I found myself at a loss. I've read lots of books. I've listened to your podcast for a long time. And that's actually where I heard about this class, was on your podcast, and really felt like that was something I needed to do to be able to share this information with more people. And the more I've learned about it, the more I feel like we are doing a disservice to women all over the place by not sharing this information right from the start. So I'm excited to be teaching this to my daughters and get them started off on the right foot. And I hope that there will eventually be a point in time where everybody who menstruates has this information and can track their cycles and know about their bodies and know about the information that their body is giving them every single month if they just know what to look for and what to pay attention to.
I love that. And I'm right there with you. I find it to be so interesting because it's when you first kind of dive into it, it's so interesting and what new, like, you know what I mean? Like, I feel like it's kind of all new and it feels, depending on your personality, it can feel a bit overwhelming. Like, wow, there's so much information here. But a couple months in, you realize it's really not that complicated. Like, why are we not like, you know what I mean? Like I feel like it's easy to slip into the taking it for granted. I'm certainly in that stage in terms of how I use it in my own day-to-day life, tracking my own cycles. Like, it's very much in the background, just like a day-to-day kind of thing that I don't even really think about. And if I wasn't constantly talking about it, I probably wouldn't really think about it a lot. Right.
Yes.
So once we are familiar with this information, it just feels like, well, obviously, well, yeah.
Yes.
So I hope, just along with you, that we get to that stage. And really, I just think it's up to us. It's just the kind of grassroots, ground floor kind of stuff. I'm not waiting for some bureaucrat to decide it's important. It's like, if you want to wait for that, you can.
I think you'll be waiting for a long time.
Yeah, I'm thinking that. And similarly, when we were having our conversation about pregnancy loss, and I can't remember how it came up, but it did come up. And it could have come up with someone sharing their own personal experience, because this is one of the things I feel like will get us into this topic of how common it is. So I've often shared on the podcast that I've had a miscarriage. It was quite early on. So before I had my first son, I was charting my cycle. So, 15 days and into my luteal, I was like, okay, I'm pregnant. And I actually waited about a week after my period was, quote unquote, supposed to come to pee on a stick. And so I peed on a stick, and then my husband and I had this lovely, like, celebratory, like, evening. And then the following day I started to bleed. So it was like very much like that. And it was a ridiculous experience. It was very painful. When I say ridiculous, I just mean like ridiculous how painful it was. Like it was like my periods had already been painful, in my 20s. So have a lot of experience with that. But this was like the most, and to this day, the most painful period I've ever had. That's what my loss experience was like. And that it was also emotionally not great. So it was just like a very kind of clash of like, it was just so intense. And for whatever reason, because again, this is where the ridiculous comes from. I think I'm not a big workout person, but I think I had gone to the gym back when I did that with my husband. We had worked out, and for whatever reason, I had done something to my knee. So my knee was also like, I could barely walk. So it was like this whole thing.
Oh man.
it was like this whole thing of like, it just so happened that I had this knee issue and I was going through this like painful miscarriage. And so it was just like that. That's why it was ridiculous. But my point in bringing that up was that after I had that experience, and I started sharing it with my friends and whatever, all of a sudden I realized that so many of the people around me had also had miscarriages, and I had no idea until I had my own and I had shared about that. It was like I was welcomed into the club. So I think the thing about pregnancy loss is that it can feel so isolating, and you don't know how common it is until you do. So I feel like that's a good kind of segue into it, because it's very, very common. We've talked about some of the stats in class, so I'll just briefly kind of like orient us in that respect. So I don't have them off the top of my head. I was going to open my book and take a peek in there. But generally speaking, the overall miscarriage rate, there was a Spanish study with over 600,000 participants. And so, generally speaking, that overall miscarriage rate was about 8 to 9%. So 8 to 9% of all, or no, am I getting it correctly? It's about 15%. About 15% of all pregnancies end in miscarriage. And then if we break it down by age, the 8 to 9% came into the kind of 20 somethings. The 30 somethings, it was a bit higher. And then by the time we get to our 40s, it's quite high, up to 50%. And so that's something that's not talked about. So that leads us into our topic today of pregnancy loss. So I'll throw it over to you if you have any comments on the prevalence and what you found in your practice. And I guess we can just go from there.
Sounds good. So I'll give you another statistic, and that is that about 1 in 4 women will have experienced a pregnancy loss in their lifetime. So this is not a rare event. If you're standing with 4 friends, one of you has probably lost a pregnancy. So it happens much more often than I think a lot of people realize. And it is a very isolating thing, because for some reason, it is not talked about very often. And I think in part that is because it is such a painful thing for somebody to go through, especially if it is a wanted and planned pregnancy. And it doesn't really matter if you knew about it for a day, or if you knew about it for a month, or if you knew about it for 3 months. That baby was wanted and loved, and it is extremely devastating to have this thing happening in your body that you don't want to happen, and you have no control over it happening. It's a really hard thing to go through. And so part of the reason I think it's not talked about is because it is such a raw, hurtful thing that doesn't ever seem to get easier to remember or recall. And then I think in part too, because if you talk to somebody who hasn't been through that, or even sometimes if they have it, I find a lot of people don't know how to respond to that. I think if you don't have an experience with having a miscarriage or a pregnancy loss, you recognize that that is a difficult thing. And as humans, I think a lot of times responding to those really big emotions in others is difficult and uncomfortable, and we don't quite know how to appropriately respond to that. And then I think if you have interactions like that when you've had a loss, that makes you kind of go into your shell even more and not want to share. I also feel like there's part of it that, like I said, it's this thing that's happening in your body and you don't have any control over it. And yet it is not uncommon for somebody to feel like they did something that caused this to happen. If they had eaten better, or if they had not stayed up so late or not exercised so much, or that there was something that they did that caused their body to pass the pregnancy. And that's not the truth of it. Most pregnancy losses are not anything that you did or didn't do. It's typically more often a genetic issue, that something didn't develop right with the baby, and your body recognizes that and recognizes that this is not a viable pregnancy that's going to continue to a live, healthy baby. And so your body knows that this is the best way to take care of that. Your body is smart. And so I just want to put this out there for anybody who's listening to it. If you've had a loss, it wasn't you. There wasn't anything that you did or didn't do that would have given you a different outcome. But it does need to be talked about, because too many women go through a pregnancy loss alone and they don't know what to expect. And that's not okay. I hope that the information we're going to cover today is not something you ever need to have. But also, if you did need to have this information, I definitely want you to have it and know what is normal and what is not, and what to expect, and have somebody to give you at least a little bit of guidance on what that looks like.
Mm-hmm. Yeah, I mean, we were talking a little bit about this before we started recording, which is that this is not a topic that either of us are, excited about discussing, because it's just not, it's just a difficult topic. And for anyone who works with women in any kind of capacity, I mean, it can come up at any point. So it's something that comes up in almost all of my classes. And what I find as well is that the pain is often right at the surface, because we're living our lives and there's very few spaces, I think, where we can actually talk about it. And so I find that in the work that I do, it does come up pretty regularly because it's so common. So to touch on something that you were talking about just, we hope that you don't need this information, but we're going to provide it because you might. So I was thinking about one of the things we always talk about with regards to fertility awareness, which is that we live in a world that's always telling us, you can get pregnant anytime, you can get pregnant on any day of your cycle. Like, that's incorrect, but that's what we're taught. And so I remember being in my early 20s and having that fear, having that constant thought of, if my partner looks at me, I'll get, like, people say stuff like that, right? If I'm so fertile, if he looks at me. And so this is the thing, that's part of the problem, because we don't really understand how our bodies work and how this process of building a baby happens. Even just that understanding how common miscarriage is, and how all pregnancies don't result in, like, all pregnancies just don't go forward because of a variety of reasons, like you said, that are not to do with what you did. That's part of what we're hoping to equip you with in terms of that knowledge and education. I feel like it does set us up, though, for that, because if you've been spending your whole life trying to avoid pregnancy, then of course you assume that it's just going to happen, because that's what we're kind of taught. I'd love to hear if you have any comments on that. And I feel like maybe we can go through from kind of earlier in the pregnancy losses all the way through. So it's, like I said, this conversation is going to be potentially just real raw and challenging. But I think we can start with some of the kind of what we can expect when pregnancy does happen early. Like in my case, it was quite a different experience than it may have been had I been further along. So I'll kind of throw it back to you and jump in.
So just to touch a little bit more on what you said, there is so much development that happens from when you conceive to when a baby is born. There is, the more I have learned about birth and fetal development, the more amazing it is to me that so many babies are born healthy and with an uncomplicated pregnancy, because the opportunity for things to go even just a little bit wrong, to have issues in a pregnancy, there's so many of them. So when you look at it that way, pregnancy is an incredible miracle, and babies being born is amazing. And so this downside that we're looking at right now of pregnancy loss and miscarriage is more common than I think we realize, but it is not how things go the majority of the time, but it is a possibility. And so we'll talk about early pregnancy loss and what that looks like. Early losses can happen before you even know that you're pregnant, all the way up until up until about 12 weeks is still considered an early pregnancy loss. And if you were to lose your baby during this first trimester, when that would be, like I said, you may know that you're pregnant, you may not know that you're pregnant. And I don't say that because that matters. Again, it doesn't matter if you knew about your pregnancy for a day or a week or a month. What you can expect is it's not uncommon to have some really intense cramping. Your body has been preparing for the pregnancy. So once you conceive, your body is, and for that month of your cycle, your body has been preparing for the pregnancy, but it continues to do that once the egg is fertilized, and the hormones that your body creates do start forming a fertile environment in your uterus for the baby to be able to implant and to grow and develop. And so if there's something that happens that disrupts the development of the baby, all of that tissue now has to pass from your uterus, because your body is going to recognize that it doesn't need that anymore, and it needs to get rid of it. So you can have really intense cramping. Your bleeding can be much more heavy than you typically have with a period. In general, you should not be soaking more than one pad in an hour when you have a miscarriage. So if you are bleeding heavily and you're soaking through more than a pad in an hour, you need to contact your healthcare provider or go to the ER. You also shouldn't feel lightheaded or dizzy from the amount of blood that you're losing. That would be another sign that you would want to go to the ER. You can have clots even early on in a pregnancy loss. Sometimes they're bigger than others. And the heavy part of your bleeding is going to be pretty short-lived. Like, it shouldn't last for more than like 24 hours that you have this heavy part. And you, depending on where you are in that first trimester, the closer you get to 12 weeks, the more likely you are to be able to identify when you pass your baby. And once your baby and the other products of conception, so like placenta or anything like that, are passed from the uterus, then your bleeding should lighten. Just a note on that, once you get to be beyond 8 weeks, you can usually identify the amniotic sac. You may be able to see your baby in there. Around 8 weeks, they're probably about the size of maybe your pinky fingernail. They're still pretty small, but you can usually see them. And if you are going through a miscarriage, it's okay to be unsure about what you do with your baby when you pass your baby, but it is something to think about. Whether your baby comes out in a pad or while you're sitting on the toilet, know what you want to do with your baby. I do recommend that you find a place that you want to maybe bury your baby, that you could have a place to go to think about your baby and connect with your baby if that's something that's helpful for you. But do something that is honoring to that baby. And one of the hardest things to go through is to not know what to do. And so in that panicked moment of like, I don't know what I'm supposed to do, is to not do anything and then feel guilty about not doing anything honoring or respectful. So just think about that before you find yourself in that moment, if you can, to know what you would want to do.
Yeah, this was one of the topics that I remember we were talking about. And I think that the way that it came about, and again, I feel like the ongoing theme of today's conversation is certainly the things that we hope you never would need to know, but that you might if you ever have to go through something like this. But I think you were sharing the example, because when you're going through something like this, the kind of natural feelings and like physical feelings, the natural physical feelings, the urges to kind of push or to empty or to, if you're having cramping and those kind of things, typically you end up on the toilet. So it's not a nice thing to think about, but what can happen is that during this event, the baby can plop into the toilet. There's no other way I can say it. So I'm just going to say it. And so in a moment of panic, you don't want to, so I know this is a really difficult topic. I feel like there's no way for me to say it other than just to say it, just to be real and just to say it. And so essentially, Rebekah, what you're getting at is you, with this conversation, as difficult as it is, it's way easier having this conversation than it is to go through the event. what we're saying basically is if you ever find yourself in a situation like this, you can give it some thought and actually, take a moment to think about what you might do in a situation like that before you're actually in it. So that because I would panic. Anyone would panic. What would you do?
Yeah. So that actually comes from a personal story. I have had 2 miscarriages. My first pregnancy ended in a loss around 9 weeks. And I was the person sitting on the toilet that my baby fell into the toilet. And I panicked. And I hate to say it, but I did. I flushed my baby down the toilet. And that was terrible. And I still think about that. And I did have another miscarriage later on. And after that first experience, I knew I did not want to do that again because I regretted it so much. And so I did. I was able to know ahead of time that I wanted, if I was able to identify the baby, that I wanted to take baby and bury it in a place in my yard. And I did. And that felt so much better to me. And what I've learned through my practice and in talking with other women who have had losses is that I am not the only one who did that or felt that way. And I think that's, goes along with this whole theme of miscarriage and how isolating it is. I know when I had that first loss and I had that experience on the toilet, I thought I was such a terrible person that I would do that and not even process really what I was doing in the moment. But then I know from talking with other women who have had losses, I'm not the only one who's done that. And I'm not the only one who's had that experience. And I'm not the only one that has that regret. And for all of us, a common theme was that nobody told us to expect that or watch for that or to think about that. It was just like, well, you're having a miscarriage. Call us if you need anything. And that I know nobody wants to talk about these details of the bleeding and the passing of the baby, and that, yes, you can identify it. And, it is a sac, and sometimes you can see the baby. I think when you're going through that, sometimes you're like, that's my imagination. Like, that's not really the baby. This is just tissue. But that's not always the case. And I just wish I had had that information. And I definitely want to help other women have that information and know what to expect.
Today's episode is sponsored by Tempdrop. I've had so many conversations with women over the years who've had a hard time staying consistent with their temperatures. So whether you're trying to conceive, avoiding pregnancy, or charting for health reasons, Tempdrop makes fertility awareness accessible to all women, especially if you've recently had a baby and your sleep patterns are all over the place, if you work shift work and it's hard to stay consistent with temping, or if you're otherwise struggling to take your temperatures each day. Identify your fertile window in real time with Tempdrop. Know your cycle, understand your body. Head over to fertilityfriday.com/tempdrop and use coupon code FertilityFriday at checkout for 10% off your order. That's fertilityfriday.com/tempdrop. Now let's go ahead and jump back into today's episode. Well, I'm so sorry for your losses, Rebekah, and I really appreciate you sharing that personal story. I mean, it's obviously not easy to talk about, but I feel like the way that you have not only going through that experience, but then with your professional work, speaking with so many women who are going through similar things, I'm sure that there's at least one, if not 10 women listening who've had a similar experience. Years ago on the podcast, I did have a conversation about loss. And so the whole episode was about loss, pregnancy loss. And one of the things that I learned, because I think unless you work in the field, similar to charting your cycle, the only experience you have is your own. So you don't necessarily know the different ways that a first trimester miscarriage can present, for example. And so one of the things I learned was that my experience of like the extreme pain and like the heavy bleeding and stuff was one of the ways it can go. I was early on, I didn't perceive a baby at that stage. Some women may have an experience similar to that, where that you don't perceive that. You just have the bleeding and tissue and it just kind of all falls together and there's no way to distinguish. And I remember the woman who I was speaking to sharing a different experience where maybe it's not as painful, but similar to what you described, like passing, whether it's the amniotic sac or like very clearly passing that, and for it to be a very different experience instead of all this blood and clots, whatever, but just to have that kind of come out, and for that to kind of be, I would imagine, because like you said, no one tells you that this could happen. So I'm not sure if you wanted to speak to the different ways it can show up. I feel like we've already touched on it, but I feel like it's, again, if you've experienced a loss, you may not be prepared for a different experience if it ever, you know what I mean? Like if you ever had a different experience in the future.
Yeah, so there is definitely a wide variety in that. And I think that's a great point to make. It can be easier to think about it in terms of how different people experience their periods. So some people have really painful periods and they have a lot of cramping. And even you yourself probably have cycles that are, you have more cramping and breast tenderness. And maybe there's some that make you want to curl up in bed with a heating pad. And then there's others that are just totally fine. Knowing what I know now, that probably has a lot to do with how you've been taking care of yourself in the month and inflammation and things like that. But a miscarriage is not dissimilar from that. So even the same person could have one miscarriage that is not a lot of cramping. Yes, you're bleeding, and yes, it's an emotional experience, but overall your body takes care of it just like it should, and there's no complications from it. But it's also possible for that same person to have a very painful, lots of cramping, lots of clotting, lots of bleeding miscarriage. There's not necessarily one way that this happens all the time. I think the important things to remember in either situation, whether you're having cramping or not, while there is variation in all of that, you should not be running a feed. There's some vital signs basically that you want to keep track of, because while it's okay to let your body pass baby and the pregnancy on its own, there would be some certain signs you'd want to watch for that. You should definitely go seek help from your doctor or at the ER or something like that. So if you started to run a fever, if your discharge had a foul odor to it, if you were soaking more than one pad in an hour, if you had clots that are bigger than like the size of a golf ball, or even, especially bigger than a lemon, you definitely want to go to the ER or call your doctor for that. It can also be helpful to have somebody there with you, because, if everybody experiences this differently emotionally. So some people don't seem to struggle too much with it emotionally, and they are just like, yep, this is the thing that happens. And for whatever reason, this pregnancy didn't last. And other people put their grieving process off. So they're very much in the moment and like monitoring themselves and what's happening with the miscarriage, and then they grieve later. And then other people are going through the miscarriage and grieving all at the same time. And especially if you're going through the grieving while you're having the miscarriage, it can be helpful to have somebody there with you who's helping you keep track of some of these other things, because it can be really hard for your mind to process how much you're bleeding and what else is going on if you're okay, while you're also trying to process the emotions of losing your baby. So that is not an easy thing to do for a lot of people. I think we want to be alone, but it can be really helpful to have somebody there with you to help you make sure that you're doing okay and that your body is passing everything in a normal way.
Mm-hmm. When you said having someone there, I mean, I even thought like they're like in the house, maybe not like depending on what you need, but like present, so that if you did have a difficult issue emotionally or physically as you're going through it, there would be someone there. I did have a couple thoughts around practical kind of scenarios, because something that I've seen quite a bit, we have spoken about this in class, it has come up in a number of different ways. Feel free to elaborate more since you're a midwife and you see these things. The body can take care of it in a lot of cases, in the sense that when it's time, the miscarriage takes place, and when it happens and it happens completely, then it has a beginning, middle, and an end, and then it's over, in my understanding there. So maybe share with us what some of the other kind of issues to watch out for. I've seen it many times with clients and with practitioners who are working with clients, where a person has gone through a loss and then at some point they start bleeding or they just don't stop. So they either they kind of have the bleeding event when the miscarriage takes place, and then eventually it stops, and then a couple of days later it starts again or something like that, or they're going through this loss and the bleeding just doesn't stop. And so I've certainly had the conversation many times where someone's like, oh, there's still some spotting and bleeding. It's been 3 weeks. And it's kind of like, what do you think? Should they take a supplement? And I'm like, no, they should go to the hospital. They should go to the doctor. They should get checked. Right. So maybe share a little bit about some of those complications, and bleeding is not good. That's like the point that I'm trying to make. We should never, ever, ever, ever just be like, it's fine to just be bleeding for weeks on it. Like never.
Right. No, that's not normal. So I'm going to go back just a little bit and say, to your point of, sometimes the body recognizes the pregnancy loss and it starts it. You have heavier bleeding at the beginning, like I said before, and then the bleeding will decrease significantly once the baby has passed, and if there were any placental tissue once that's passed. And then, yes, you could bleed for about 2 weeks. That bleeding should continue to get lighter every day. You shouldn't maintain heavy bleeding for 2 weeks. That would be a sign of something that you'd want to go to your doctor for. But if you had heavy bleeding at the beginning and then it tapered off over the next couple of weeks, that would be considered normal. Sometimes what happens is you can have a pregnancy loss and your body doesn't recognize it. I've worked with several clients who go to the doctor for an ultrasound and find out that their baby has passed and their body has not yet recognized it. And you have options if you have something like that happen. You can wait for your body to recognize the loss of the pregnancy and pass the baby on its own. You should expect for that to happen within 3 to 4 weeks, though. If it's been more than 3 to 4 weeks and you have not passed baby on your own, you might really want to consider some of the options that your doctor or healthcare provider can give you to help your body pass baby. The longer your baby stays in there, not alive, not growing, not developing, it does increase the risk of infection for you. So that is something to consider. If you go to the doctor and you find out that your baby has passed, you do have options of inducing the miscarriage. So there are medications that you can take that will cause your body to start passing your uterus to contract and pass all the tissues and the baby to get you on the path to recovering. And I've worked with people that have chosen both ways. There's not a right way or a wrong way to do that. Neither way is easy. Like we talked about, even without medication, you can have intense cramping and pain. The medication can cause that too. So there's not an easy way to do that. No way is fun. So to your point about continued bleeding, like I mentioned, when you have a miscarriage, whether you take medication to start the process or your body begins it on its own, it should take only about 2 weeks for your bleeding to go away. And your bleeding should continue to lighten for that whole time. If you are 2 weeks out and you're still experiencing bright red flow of blood every day, that would be a reason to contact your healthcare provider and go in to be checked out. That would not be considered normal. You should be down to really just spotting even by 2 weeks. So that's kind of the normal bleeding time after a first trimester miscarriage. It is longer than a regular period. So I don't want you to expect it to just be a 5 or 6 day flow of blood like we typically experience when we have our period, because it is usually more than that. And that's okay. That's not a problem as long as it's continuing to lighten in amount throughout that time.
Mm-hmm. And I mean, this comes up so much because of the charting aspect of it that I'm just going to say it again. Like it can be very serious. So serious in that what you said, if you're still bleeding significantly at 3 weeks, or even just still like if even spotting eventually should stop. So there shouldn't be bleeding. So if you're still bleeding and it's been several weeks, you could have retained tissue, and that can cause an infection, and you can get very sick or die from that. So I have to say that because you have to know that it's serious.
That's another good point, is that your cramping really should lighten up after the majority of those tissues have passed. So if you're far enough along that you can identify baby when baby comes out, your cramping should lighten up after that. If you're continuing to have intense cramping for 24 hours beyond that, you would want to contact your healthcare provider because that's not considered normal for a miscarriage.
So, and again, we're not trying to scare anybody,
Right.
but it's more just trying to be honest. And part of the reason that I'm saying this as well is because I've also, I don't know if you've had this experience, you probably may have, maybe, I don't know, but I've spoken to women clients who have had miscarriages and who have had continued bleeding and who have been told that it's fine.
Mm-hmm.
And I'm the one saying, no, 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 go in, get them to do an ultrasound, please, today.
Mm-hmm.
uh,
Yeah.
Only to find out that they had retained tissue and then they needed an emergency D&C or not. There's no such, I don't think there's
Right.
such thing as emergency D&C. That's the wrong language, but you know what I'm saying? Like they actually needed to have medical intervention. Not that that's a case for everybody, but at the end of the day, I feel like it's so important for us as women to get a good sense of what's normal for us and what's abnormal to advocate for us, because there are even times when you may get the incorrect recommendation from a healthcare provider, which is terrifying, but it happens.
Yes. And that plays into, I think, a lot of women's health in that if there's not an obvious problem, then it's really easy for providers to push us off and be like, oh, it's fine. And I do think that a lot of providers are not familiar enough with women's cycles to know what's normal and what's not normal in them. And so if you know that it's not normal, which hopefully you do now, that if you were to be bleeding for 3 weeks after you have a loss, that you could go to your provider and say, this is not normal. And I feel like that needs to be checked out, because they may not know. They may just be like, well, you're not having, if your vitals look fine, right? Like if your temperature is fine and you're not having intense cramping, or then they could be like, well, everything's fine. So it can be really helpful for you to know that that's not considered normal, so that you can advocate for yourself and help yourself get the care that you need.
Mm-hmm. Well, and one other question for you. So then outside of these complications that we've been talking about, if you do have a fairly kind of uncomplicated miscarriage, fairly straightforward, even if it's painful, even if you have cramping, but it has a beginning, a middle, and an end, and then it's over within the timeframes that you've laid out, do we need to go to a doctor? I felt like to say, to kind of follow it to what we were talking about, like if you do quote overreact, which I don't think you will. I have never really seen that. I only see
Mm-hmm.
underreacting. But if you did, and really it was fine, you would go to the doctor and they would check you and they would tell you it was fine and everything would be okay. You know, I feel like it's just not a big deal if you get checked, like just to make sure.
Absolutely.
But do you need to go to your doctor then in general if you are having a loss?
I don't think so. That's my personal opinion. I don't think that you need to go if you're meeting like all of those normal parameters that we've talked about, then I don't think you need to go to the doctor to be checked out. That's everybody's personal preference, though. I feel like some people do want to go to the doctor and have that reassurance that everything is okay, and there's nothing wrong with that. But I also don't know that you need to, if your body is doing things on its own and nothing is outside of normal.
Yeah, so I guess the takeaway is know when you need to. I know for
Mm-hmm.
myself, even though I had an early loss, I still went and I still had the ultrasound. And it was an interesting experience because I think I've shared this potentially, but obviously I chart my cycles. So I knew when I ovulated. And it was my first pregnancy ever. So when he asked me what the first day of my last menstrual period was, I told him. And so in that particular cycle, I had ovulated likely around 3 weeks after my period, like so like cycle day 21 or 22, I don't remember exactly, but it was not cycle day 14. And I remember having to listen to him explain to me how the baby looked too small and all this kind of stuff. And if I hadn't charted my cycle, that would have concerned me. But yeah, so anyways, I guess that's just a piece of it in case that's interesting to you. But the point is that I know for myself, I actually did want that confirmation. I was really nervous. That was the first time I had gone through anything like that. Had it happened another time, potentially I would have just, similar to what you were saying, Rebekah, if everything kind of went as normal, bleeding stopped, pain stopped, all of that, I may have just taken care of it on my own.
I do think of it kind of like your regular cycles, right? Like there is a normal pattern that your body has. And if you're staying in that normal pattern, it's fine for you. You don't have to go get that checked out. And there is some variation in that normal, as we've talked about previously, but it is also important for you to know what are the signs that things are outside of normal and that you do need to go seek help out elsewhere. And I think that's a really important point of what we're trying to make today, is just to help if you ever find yourself in a situation of a pregnancy loss, of when you should seek care from a professional. You can seek care and advice from a professional anytime you want to. That's not to say that you have to wait for something to be outside of normal before you go see your doctor or your midwife. But definitely, if things are going outside of normal, then you need to.
Yeah, I couldn't agree more. Jumping into today's episode with some exciting news to share. The Fertility Awareness Mastery Mentorship Program, Class of 2023, starts in January. If you've been searching for a practical way to incorporate fertility awareness cycle charting into your existing women's health practice, then this is the program for you. The Fertility Awareness Mastery Mentorship is a 9-month program that provides the necessary training to incorporate fertility awareness cycle charting into your existing practice. This program cuts out all the fluff by combining the science with the practical application of charting, and allows you to support your clients by monitoring their 5th vital sign in a standardized way. Finally, a program that teaches you to use the menstrual cycle as a diagnostic tool with your clients. Transform your practice in 9 months. Apply now at fertilityfriday.com/FAMMlive. That's fertilityfriday.com/FAMMlive. Now let's go ahead and jump back into today's episode. Well, I feel like we've really delved into first trimester, which I think is really important. My understanding is that a higher percentage of miscarriages happen within that first trimester. So chances are, if you're experiencing a miscarriage, you're more likely to experience it at that stage. So I think it's really good that we took the time to flesh out. I'm sure we haven't addressed every possible thing that could happen, but I feel like this is way more of a roadmap than I ever had before I had my first miscarriage. And if anyone is listening who's also had a miscarriage, I'm pretty sure you'd be nodding your head, So I feel like this is really helpful. This is almost like a little mini class that we're doing here on air. So hopefully this information is helpful to you. But let's move into even more difficult territory, which would be second trimester loss, which I know you were saying is typically when you're seeing it between week 16 and 26, although I'm sure that absolutely could be a different. So I guess a good place to start would just be just from what you've experienced, what you've seen, what are some of the main differences? Obviously, there's going to be some similarity to what we've been talking about, but this is a different ballgame at a later stage. Baby's larger, obviously also emotionally very, very difficult at that stage. So I guess we can just share with us some of those differences.
Yeah, so once you get into the second trimester, a loss feels more like birth. You're more likely to have contractions that you notice that come and go, just like you do when you give birth to a full-term baby. Around 12 weeks, the placenta is formed and has taken over hormone production, and so it's not going to. A first trimester loss has a lot more bleeding and tissue that is unidentifiable tissue, but a second trimester loss, especially once you get to be, like I said, most of the ones I've seen have been between like 16 and 26 weeks, and it does more resemble birth. You can feel your water break and have a release of fluid. You typically have contractions that you feel, and you will definitely be able to notice and identify your baby when you give birth to your baby. Around 12 weeks, your baby is about the size of, it'll fit in the palm of your hand. And baby just keeps growing. So it just will get bigger and bigger, but you will definitely be able to identify and notice when you give birth to your baby. And then you will also pass placenta. You can usually identify the umbilical cord. Later in the second trimester is even more like giving birth to a full-term baby. Your waters will release. You'll have regular contractions. You will deliver your baby. Babies are more likely to be born breech in a breech position, because one of the things that helps baby turn head down as you get closer to full term is that their head gets heavier than the rest of their body. And that's not, and they've got so much space when they're smaller in that second trimester. So babies aren't always head down. So you may have baby's feet come out first, and that's okay. But you will deliver your baby, and then you will still have to wait for the placenta to deliver. And this is an important time to have somebody with you. If you're having a loss in the second trimester and you're choosing to stay at home, definitely have somebody with you. That placenta is functioning, but it is not developmentally at a point where it always detaches from the uterus very easily. So that's one thing that your body sort of prepares for as you get closer to full term in a pregnancy. And sometimes that placenta does not release like it should, even after you deliver your baby, which can lead to heavy blood loss. And a lot of the families that I've worked with have chosen to be in the hospital for that very reason, just to have access to help and interventions if they were to need that. Although I will also say none of the women that I've worked with in this situation have needed that. Their bodies have always been able to deliver the placenta and not have heavy bleeding. But that is a consideration and something to think about if you are having a second trimester loss. Another thing to consider is that, like I said, you are definitely going to be able to see your baby. Your baby will be an identifiable little baby. It looks just like any other baby. It's just much smaller. And some women want to hold their baby and some women don't. And there is not a right or a wrong answer to that. It is whatever you need and whatever you want to do. I do always recommend to my clients that they have somebody take pictures, even if you don't want them right now. Just have somebody take pictures and hang on to them for you. You may decide a month or a year later that you want to have those, or you may not ever want them, but you can't take them later. So it's always best to have somebody there who will take some pictures for you, especially if you choose to hold your baby. There have been some moms that I've worked with that have really loved having those mementos of the time that they had together. And that is that. Do you have any questions about that? I don't know if that's enough information or.
Well, I always have questions. That brought tears to my eyes. I mean, I've just had a baby. Oh, it's just, and it's so hard to hear that, because it would be the last thing you would be thinking of doing. And this is why you have to say it. This is why you're talking about it, because I can't imagine that if I was going through something like that, that it would even occur to me to take a picture. I can't imagine that it even would. And what you said is so true. Some women just, you wouldn't even think about it, but 2 months down the line, when you're not in that active stage of just unrelenting grief, you then might regret not doing that. So I feel like there's so many areas of life as a woman going through motherhood, pregnancies, breastfeeding, birth, all of these things, that there's so much value in being around or having access to wise women who've been through these things, because there's so many things that we just would never know. So I feel like this is part of the, metaphorical kind of red tent knowledge, if you want to call it that, or something like that. But I feel like over the years, I've been very fortunate to have been welcomed into a lot of these kinds of conversations with the charting, having found it so young, and working with older women who had charted for a longer period of time, who could teach me so many things. And I just feel like there's so much wisdom in these things, even though they are really hard. Even what you said about holding the baby, I just feel like we don't really talk about miscarriage at all as a culture. Yeah. It's just this thing that happens in private that no one talks about. So even all of these details about, okay, it's more likely to be breech, and what do you do? And do you want to hold the baby? And do you want to take a picture? And what about the placenta? And all of these things that are very practical, but who would ever know if you've never even had a baby before, if this is your first? That's heartbreaking even more. But if you've had a baby, you kind of know about that. You kind of know, okay, the placenta comes after, and that kind of thing. But I feel like this is just a really hard, but for anyone who does happen to listen to this episode and then at some point goes through something like this, or has a friend who goes through something like this, you're just so much more, you're never prepared, but you at least can manage it a little better.
Yeah. I did think of two more things I want to mention about second trimester losses that is important to know. The first one is hard to even say, but your baby does not get a birth certificate when you give birth in the second trimester to a stillborn baby. Birth certificate is called a certificate of live birth. And because your baby is not born living, they do not issue a birth certificate for your baby. And I think that's something important to know and be prepared for. Most hospitals will still do some sort of a certificate. It's not an official birth certificate, but just like that you gave birth to your baby if you want that. They can even do footprints for you for your baby, and that can be the mementos that you have from that. But I do want you to know that your baby does not get a birth certificate. And the other thing is that if you have a loss after 16 weeks of pregnancy, your milk will come in the postpartum. Once you get to 16 weeks of pregnancy, your body starts making colostrum. So once those mammary milk glands have started to prepare to make milk for your baby. And so when your baby is born, your body will recognize that your baby has been born and it will create milk. Some women will donate the milk, they'll pump and donate milk, and that helps them through the grieving process. Other women will take herbs or other medications to dry up the milk because they don't want to be reminded of that they don't have a baby to give their milk to. Again, there's no right or wrong for that, but it is something to be aware of and be expecting if you have a loss after 16 weeks.
Well, one question that I had been thinking of, I think we had touched on this a little bit when you shared in the first trimester, often you'll just start bleeding and that'll be how you're aware that you're having a miscarriage. But there's other times when you wouldn't, that doesn't happen first and you're being told that there's no heartbeat and that's how you find out. So in the second trimester, I mean, I'm guessing it can happen either way, but maybe if you could talk a little bit about that. At some point in the second trimester, depending on how far along you go, you start to feel the baby. Mm-hmm. So of course, having that movement stop would be something that would prompt you to look deeper into that, obviously, but maybe you could share a little bit about how that can work.
Yeah, I've found three most common things. One, your water breaks. For some people, that is the first sign of that something's not right. The second is that, you stop feeling movement. And then the third is that sometimes you start bleeding. Usually one of those things happens before you start feeling contractions. But I have had a situation where contractions were the first thing that somebody felt. In my experience, that has been more uncommon than having water break or stopping feeling movement or having some bleeding.
Mm-hmm. So, I mean, if there's anything else that is on we need to know this for second trimester, let me know. What you said before we started recording was exactly what it is. Like, I know that women need this information, but this is not necessarily a conversation that I'm looking forward to in that sense, because it's so hard to even talk about. But moving into third trimester, so stillbirth, I'll link the episode for anyone who wants to dive into it. I did an episode probably a year or two, maybe 2 years ago, with Christine McAllister, and she came on the show to share her personal experience with stillbirth. And it was just a heartbreaking episode. And she shared some of the things that you had alluded to, taking a picture and all the different options. One of the things that she shared was that her midwife had, I think, encouraged her to deliver vaginally for a number of reasons. And that was hard to hear, hard to discuss. And she had talked about some of the reasons why the midwife had suggested that. Easier on the body, even though it's labor, quicker recovery time, but also you have all the flood of hormones and helps with the, grieving process and all that. So it was just such an interesting and heartbreaking story. So I feel like when you said at the beginning, toward the beginning of our conversation, that when these things happen, people don't know how to respond and that they want to be supportive, but they just don't know how to respond. I feel like stillbirth falls into that category because my heart just breaks even thinking about that. And I don't know many things in life that would be as traumatic and sad and heartbreaking.
Absolutely.
So I guess we're gonna go into it, even though I'm already
Yeah.
on, like, tears are already on the brink right now.
Yes, this is not a fun conversation for sure. So, stillbirth happens. There are several reasons that can lead to a stillbirth. And when you have a loss in the third trimester, it is often found from lack of movements. So you will have been feeling your baby move regularly, and then those movements stop. And you should feel your baby move every day. Your baby should have regular movement patterns. And I think this is an important thing to let everybody who's pregnant know, is that when those patterns change, especially when they're changing significantly, you need to get in touch with your healthcare provider. I hope your healthcare provider has talked to you about doing kick counts for your baby when you get into the third trimester. That's a really wonderful and easy way for you to keep track of your baby's wellness. And if you notice that those movements are slowing down, you'll want to contact them. But typically, third trimester losses are found because baby hasn't moved in 24 hours and they come in to be assessed and there is no cardiac activity found for baby. And that is a really devastating thing. Nobody really, I think it's hard. My experience, I am a midwife, and so it's hard for me too. And I think it's hard for doctors as well and labor and delivery nurses, because what we often deal with are happy births. A family meets their baby for the first time. And so it is not easy for us to know what to say. I know we all wish we could change it, but we can't do that. And it's hard. All you can really do, or all I really know to do as a provider, is to hold space for whatever you need. I've had families that have gone home and just needed some time to, she wasn't in labor, there was nothing going on, and just needed some time to wrap her brain around it and do some grieving and prepare for the birth of her baby that wasn't, she was never going to hear her baby cry. And that's a hard thing to realize, that you're going to go through labor just like you planned, and you're going to give birth to your baby just like you planned, but you're not going to hear that cry that we all wait for when the baby comes out. And all of the dreams that you had. The third trimester is really hard too, because there's so much that you've done at home to prepare for your baby. So most families have a nursery all set up, and they have all of the clothes washed and hanging in the closet. And it can be helpful to have somebody. Some clients that I've worked with have felt that it was helpful to take care of all of that themselves, but it can also be helpful to have other people come over and take care of that for you, so that you don't have to be the one to go through that and pack it up and get rid of it. Again, I know these are terrible topics to think about, and I recognize that. But if you find yourself in this situation, it is okay to ask for help for that, and know that grieving is a process, and it's not going to happen all at once, and it's not ever going to be over. Nobody gets over the loss of their baby. So, yeah.
This is why we were not looking forward to this conversation. Oh my goodness. But all I can say is that if it's this hard for us to talk about, and we're both there, we're both crying right now. If it's this hard for us to talk about, obviously this is why we're doing it. If it's so hard to talk about, just imagine how hard it is to go through it. And for someone who's listening who has gone through it, obviously our deepest sympathies and our heart goes out to you, and our deepest condolences. It's just not how it's supposed to be. It's just wrong. Obviously, we're supposed to have full lives and die when we're old.
Yeah. So a couple of things I do want to say about third trimester losses. One is that you'll probably be at the hospital. I think most people choose to be there. They do have, I believe they're called cuddle cots, which are cooling cots so one thing nobody wants to think about is that when your baby is born and they're not alive, their body starts to decompose, and you can prolong that, or postpone that a little bit by using a cuddle cot. It's a cooling cot that will keep their skin from sloughing off and that kind of stuff. So if you do want to have more time with your baby, make sure you ask about that. And then hospitals are usually really good at having resources for you, but you may need to, if you want to have a memorial service for your baby, that will be something that you want to ask about and get information on for you and your family.
Mm-hmm. For better or for worse, that reminds me of, I think my husband talked about this once, where he knew somebody who had a stillbirth and had a service, and that's we'll just stop it there, but there's like nothing harder than that. Yeah. But, Rebekah, although this was a really difficult conversation, I really do appreciate that we had it. And I feel like as much as this is hard to hear, I will have in my introduction done a bit of a warning for anybody that this is definitely an episode that's triggering and certainly difficult topics we're covering. But this is why we're doing it. It's so important. It's hard enough to go through something like this, let alone in a world where we don't really talk about things like that. We don't really prepare women, and we don't really have those conversations about what to expect and some of those details that just make it so much worse if you didn't even know that that could be a possibility. For women who are potentially going through something like this, having their midwives or their doctors explain these things and take them through that is also so important. And I think all of your clients are blessed. I mean, most of your clients don't have to go through this experience as well, but you know what I'm saying? Even just how you have talked about it with us today and how you've taken us through everything, having you there as a support to help them through these processes is so important. So definitely something to think about when you're choosing a care provider when you are pregnant. Hopefully having a supportive person there who's really helpful for all of the possibilities. So I'm not sure if you have anything to add to that.
I just want to add one thing. If you are a healthcare provider, whether you're a midwife or a doula or a doctor, there's a really wonderful book called Companioning at a Time of Perinatal Loss that gives a lot of helpful information for ways that you can help your families and give them, kind of talk them through and be supportive through that time. I wish I could remember the author's name, but I don't remember it off the top of my head. But that is a wonderful resource for somebody who's in this profession, because if you do birth work long enough, you will eventually work with families who have losses.
And the name of the book again is?
Companioning at a Time of Perinatal Loss.
Okay, well, I'll make sure to link that in the show notes page, and we'll figure out who the author is. So if you're listening on the go and wanting to jump into that resource. All right. Well, Rebekah, so let's shift gears a little bit before we wrap up today. Thank you for taking a little bit of extra time. I know we went a bit over the usual time frame there, but I feel like it was a very good use of our time. So shifting into just what you do and the work that you do, maybe share with us where you are in the world, the name of your practice, website, socials, for anyone who's listening who happens to be in your area.
Perfect. Well, I am Rebekah Mustaleski. I own Roots and Wings Midwifery. We are located in Knoxville, Tennessee, and we do home births. We're a midwifery group that provides prenatal, labor and delivery, and postpartum care. And you can find us on social media on Instagram. We are Roots_Wings_Midwifery. And we're also on Facebook at Roots and Wings Midwifery. And then online, you can look us up on our website at www.rootsandwingsmidwifery.com.
Awesome. And maybe, in a future episode, we can turn the tables and talk about a funner topic, which is also equally important, which is home birth. I would love to delve into that. I've had 3, so it's so interesting because it's still kind of out. Not everyone's doing home birth, but it's
true.
So for me, it's like, okay, but it's always a really interesting topic. So maybe we can do that at some point. And
I would love that. It'd be a whole lot happier.
Yes. More smiles and laughs and giggles. And one last question, although we spent the majority of our time talking obviously about loss, and that was the point. So again, I hope this episode is a blessing to anyone who is going through these things. But I did want to just ask you before we wrap up, as we're recording this, today is actually our last quote official FAMM class. So you've been in the program, an active participant this whole time. And I know you had mentioned at the beginning of the call that your experience cycling has been, I would say, great. I mean, your cycles have been pretty regular, no real complaints. And so I would love to hear from you now that you're kind of approaching the end, how has it changed? So how has the program changed the way you practice or your outlook, or what have you found to be beneficial, especially considering the listener who has been thinking about maybe jumping into the program?
So personally, the program has definitely helped me understand my cycle in depth far more than I ever did before. I not only know that my cycle is normal, and I'm very thankful for that, but I also know signs to watch out for just in case that were to ever change. Now I know what is a normal variation and what is something that I would want to contact my healthcare provider about. And I very much value that information because I just don't feel like I knew that before. And as a practitioner, I feel so much more capable and confident in helping my clients with the variations that they have in their cycle. I have a very boring cycle. And again, I'm thankful for that, but that meant that there are all these people that have an experience outside of what I do. And I did not have the information to be able to help them create healthy habits and lifestyles to regulate and bring their cycles back into what would be a more normal pattern. I didn't know how to help people that wanted to use fertility awareness postpartum, if that was what they wanted to do for family planning. And now I know how to do that. So if you choose to do this program, you will learn so much, not only for yourself, but also for all of the clients that you work with. So it is definitely worthwhile. And I am so glad that I've been able to be part of this program.
Well, thank you so much, Rebekah. I've been thrilled to get to know you over the past year. And I really appreciate you, like I said, for coming on and tackling this difficult topic with me. And
absolutely.
And so thank you again, and I will see you again soon.
All right. Sounds good. Thank you.
Thank you for listening. If you enjoyed today's show, please share it with a friend. You'll find the show notes page for today's episode over at fertilityfriday.com/446. All right. As I mentioned at the top of today's episode, this was certainly a heavy one. And there was a couple of times when both Rebekah and I had tears in our eyes. But as I mentioned at the top of the episode, our hope for this conversation is to raise awareness. As I was having this conversation, a similar conversation with Rebekah before we decided to do the interview, and she was sharing some of these details for how to manage loss at various stages of pregnancy, it really struck me that these are things that women should know. And that's really why I invited her to come on the show and share these details. And so although it's a hard conversation to have, certainly a difficult episode to listen to, I feel that these topics are important to cover, regardless of how hard they are, if it could help even one woman who finds herself in one of those situations that we talked about. So at some point in the future, I will invite Rebekah back. She's got lots more to talk about other than the heavy stuff. And so I look forward to having a conversation with her in the future. And I think one of the topics that we thought about delving into is home birth, which is very close to my heart. We'll arrange that at some point in the future so that we can just share a different side of her work. But I am really thankful once again that she decided to come on the show and have the conversation that no one really wants to have, in the hopes that it'll bless somebody who needs to hear these details. So with that said, I hope you have a wonderful weekend, whenever you're tuning into the show. And of course, as always, until next time, be well and happy charting.